Lab video is gonna be starting with the spinal column. Spinal column is made of like 26 vertebrae, and if we are gonna count it like 7 cervical, 12 thoracic, 5 lumbar, and then sacrum as one piece, and then coccyx as one piece, it would be total of 26 vertebrae. If I'm gonna make the sacrum like 5 pieces united together, and the coccyx is gonna be 3 pieces united all together, so we may have it like total of 33. So it's either. Now we'd like to see the normal curves of your spine. In the cervical region, as you see, it makes a convex curve looking forward. Curve more forward like that, convex, if I'm looking from a front view. Same thing if you go for the thoracic region, it shows concavity from an anterior view. So it has a concave shape like this. And then we go back again down to the lumbar region where we can have convexity forward like this one. These are normal curvatures. Abnormal kind of curvatures is an exaggeration of the normal ones. So first type is called kyphosis. It's an exaggeration of this lumbar region of kyphosis is an exaggeration of the thoracic region to be more bulging to the back, so you can have the kyphotic shape. Next is lordosis, like when you have a lady got pregnant. This is more exaggeration for the lumbar region, so that you have a lord-like shape that we name it as lordosis. Both kyphosis and lordosis are in the anteroposterior diameter. If we are going to take it on the side view or a lateral diameter, it will be like scoliosis, would be tilted to one side of the body. When we got start, different kind of vertebrae, and then we try to find which is typical, which is atypical. Let's get started with the cervical 7 vertebrae. All together should have this opening, a common criterion for all of them. This opening is for the artery going to the brain called vertebral artery, and that opening runs in the transverse process. Let me, before I go through this, let me try to make just a quick overall kind of anatomy of any vertebra. Any vertebra in simple form is made of a body, a transverse process, and a spine. Of course, this is very concise kind of anatomy. So it's a body, a transverse process, and a spine looking backward. In the cervical vertebrae, all of them should have this opening, so that's criterion number 1. Criterion number 2, to be talking about typical cervical, like this one, it has a body, it has the opening for the artery, foramen transversarium, and if you look to the spine, it has a bifid shape, like as it makes like a V shape like this. We name it as a bifid. So if you have the 3 criterion, this is typical cervical vertebrae. How many of those typical? They are from C3 to C6. 3, 4, 5, and 6 are typical cervical. What about the atypical? They are C1, C2, and C7. Let's go for C1. Why is atypical? Where is the body? There is no body. Where is the spine? There is no spine. But we still have the opening, the foramen transversarium, which is the opening for the artery going to the brain. Okay, that's C1. It has a name, it's called atlas. If we go for C2, C2 is atypical vertebra. Why? It has 2 bodies. This is the body, number 1, and this is her own body. This one is stolen from the C1. C2 has a name, and these are the only 2 vertebrae. This one is called axis. So we don't have any other names for any vertebra. It has 2 bodies, and that's why it's atypical. It shows the opening for the artery, and it may show bifid spine or it does not show. So it's either this or that. But once it has 2 bodies, it's atypical. Then we go to C7, the last cervical vertebra. This one is atypical. Why? First of all, it has the opening for the artery, foramen transverse area, and the body is there, but look to the spine, is no more bifid, and that's why it's atypical. If you go to the thoracic vertebrae are 12 in number. The first one and the last cervical are both like a carbon copy of each other. If you look at these two, both have a spine, and the spine looks like straight with the horizontal. But the only difference is T1 has no opening in the transverse process because the artery starts from the level of C1 and goes up to the brain. Thoracic vertebrae are 12. The 12 thoracic vertebrae, we can make the difference between like this. C1, look to the spine. It looks straight, horizontal with the straight line like this way. So it makes the spine is making this straight line. If you go lower down, this one starts to have a spine, looks oblique. If we're still going more down, it's more oblique, going to down. The same way. So we can also compare the size of the body. The size of the body is too tiny with the first group, and when we go down, they start getting bigger and bigger until we go to the 9th, 10th, 11th. Compare that size of the body to that one. There is a big change in the size of the body. It looks bigger in lower down kind of vertebrae like that. And then still we have the obliquity of the spine backwards. The last three have a huge body like this. And once we start on the most back three, which is 10, 11, and 12, look to the spine, how it looks like. It looks broader and it starts to be straight with the horizontal one more time. But the size of the body is very huge compared to the other one. There is something also that is very clear and is very common in all thoracic vertebrae. You already know that your ribs are attached to the thoracic vertebrae. So in any thoracic vertebra, we should have on the body a smooth area like this and another smooth area like that to be attached to the rib above and the rib of the own vertebra. And these are named dummy facet. So if I have it, this is one dummy facet and this is the other dummy facet. Let me see another. One more vertebra for thoracic. Here you go. Here is one dummy facet, this area, and this is another dummy facet. Again, this is a small flat surface to be attached to the head of the rib, one above and one the rib below. So it should have two of these small areas. We name them as dummy facet. This is all what you need about thoracic vertebrae. If you go to the lumbar vertebrae, see the five lower down vertebrae here. They all have a huge size body, transverse process with all these kind of criteria. We don't need all that detail. And then the spine looks backward and it looks broader and looks like straight with a horizontal like this. So nothing needed to be known about these lumbar vertebrae. This is about your spine. Next is going to be this breastbone or sternum. Breastbone is made of three pieces. The top piece is called manubrium. The middle piece is the body. The lowest is the xiphoid process. If we look to the manubrium, it has the suprasternal notch, which is high up there. And at the end of the manubrium, if you move your finger all the way down, you find it getting raised at a line. We name this line as angle of Lewis, sternal angle of Lewis. Why that angle? If you look from a side view, it makes an angle, obtuse angle, the manubrium with the body like that. We name this one as sternal angle of Lewis. We use that one to know how to count ribs because the sternal angle of Lewis lies opposite the second rib right away. The space between two following ribs is called intercostal space. So we can start counting first intercostal space, second, third, fourth, and so on. This is the sternum. Now we go for the ribs. Ribs, actually, we do classify them into true ribs and false ribs. What do I mean by true ribs? True ribs are those touching the sternum from the sides. So how many of those? Rib 1, 2, 3, 4, 5, 6, and 7. 7 is the last one to be considered as true rib. Next to the 7th, we have 8, 9, and 10. These are false ribs. And then we have two floating ribs, most lower down. This is the 11th, and this is the 12th. When you study such rib, any typical rib, whether it's false or true, it should have a head, it should have a neck, it should have a tubercle, and then we have the body or the shaft of that rib, and it ends with a cup-shaped area. Why? As you see, each rib is attached to a piece of cartilage, where cartilage is going to be attached to the cup-shaped area. So we have any rib should have all these kind of anatomical parts: head and neck, tubercle, shaft, ending with this cup-shaped area. Okay? We need to verify which number for these ribs. This is rib number 1. Rib number 1, shortest, flattest, and broadest. And when you apply it on the table, it looks like flat with the table. Rib number 2 is a little bit bigger than that one, but is never been flat with the table. As you see, it makes a curve like this way. Any other rib, either false or true, with this kind of long, you cannot figure out which number. You just mentioned this is a typical rib having a head and neck, a tubercle, and shaft. The last two floating ribs, actually, you can easily identify. You may be confused between rib 2 and rib 11. They may have the same length. But if you look for rib 11, just have barely you can find the head. Nothing details on that one. Rib number 12, just only maybe you can find the head and nothing, and is very short compared to the other ones. This is all what you need to know about your ribs. Now we move to the skull. The skull, to study the skull, we need to study it from all views. View in Latin means norma. So when we start looking from a front view, this is norma frontalis. From a top view, like this is norma verticalis. Side view, norma lateralis. From a back view, norma occipitalis. And then we look to the skull from the basal view from outside, and then another basal view from inside, norma basalis externa, norma basalis interna. Let's start from norma verticalis, a vertical view or a top view. When you study the skull from a top view, it's made of these bones. The most anterior one is the frontal bone. On each side, we have two parietal bones. Lower down, we can see two temporal bones, like this. This temporal bone. On the most back, we have the occipital bone. Each of these bones is united with the nearby by what's called suture line. Suture lines are wide apart when you're young age. When they got closer with age, you may not be able to see the suture line. We have two important meetings between this frontal or coronal suture and this middle or sagittal suture. I have here a diamond-shaped area like that. We name it anterior fontanelle or bregma. This is membranous up to the age of 2 years. From the 1.5 years to the age of 2 years, is going to be changed into bone. Is no more membrane. If you look to the back, we have this is the sagittal suture. This is the lambdoid suture between the occipital bone and the parietal bones. And we have here a triangular shaped area called posterior fontanelle or lambda. This one closes completely or changes into bone at the age of 6 months. This is from a top view. Let's go from a front view, norma frontalis. From a front view, the skull looks like that shape. Yeah. From a front view, we have the frontal bone, the frontal bone most high up. We keep going lower down. You can easily know this is a male or female if you have a prominent two pieces like this called frontal eminences. If they are more prominent, this is a male. If it is soft like, this is a female. If you go lower down, you can see the supraciliary edge or ridge, or you can name it supraorbital ridge. In between the two supraorbital ridges, we have this piece of bone called